We'll be joined first by Niamh Fitzgerald, who is the president of ICARA, who will be giving a brief overview of ICARA, followed by presentations from our speakers. So during the presentations, if anybody has any questions or comments, please feel free to use the chat function. After each speaker, we will have 5 minutes for presentations, and you can use the raised hand function if you have any questions during that time. But please do feel free as well to pop on the chat. And you could also follow our Twitter chat at ICARA_global. We'll be doing some tweeting there as well. And you could also be using the hashtag ICARA webinar as well. So please feel free to tweet as we go along. So I'll hand over now to Niamh to talk about ICARA.
Really great to have everybody here. Thank you, Andy, for the introduction. I'm going to just very briefly introduce ICARA because I know that it won't be an organization that is familiar to many of you. ICARA is the International Confederation of Alcohol, Tobacco and Other Drug Research Associations. And this is our 5th webinar on alcohol consumption in Latin America during COVID-19. And it's a great pleasure for me to welcome you on behalf of ICARA. A little bit more about us. So we are an umbrella organization. We've been around for about 10 years. So our members are primarily research organizations, associations, networks, societies, and teams. So we have organizational rather than individual membership. And our mission is to promote, support, and enhance research on these topics nationally and internationally, particularly through professional exchange, collaboration, and other activities. We have a specific focus, a very intentional focus on capacity building, peer-to-peer learning between societies and organizations, both within and between countries, and we are non-governmental. We also are multidisciplinary. We believe that the input of academics and researchers from a whole variety of disciplines and backgrounds are necessary to tackle these issues. And so we do not prioritize any particular discipline. Our membership is quite diverse. It has varied over time. So in the past, we have also had organizational members from North America and Asia, but just now our membership is split in bulk between international and European organizations with some from other continents. And this just gives you a little bit of a flavor. So I'm not expecting that you'll be able to read all of this, but our full members are those organizations that themselves have individual researchers as members. And our associate members are just any research team or network or organization who wishes to support our aims and to gain the benefits of being connected internationally to other organizations. If you go to our member directory on our website, you can access information about all of our members. There's a named person there for all of our members and a link to their own websites. So if any of these networks catch your eye as something that's relevant to your work, please do check it out on the website. Our main purpose, I suppose, is to offer our members a chance to access a global audience. So I know that personally, my area of research is primarily alcohol, but there are other topics that I dip into from time to time where I might not be a signed up member of an international network, say on cannabis or drug policy, but I might still be interested in seeing announcements about events organized by one of our members, the International Society for the Study of Drug Policy. So it's a chance to disseminate news across our networks to people who are members of other organizations who might still be interested in your activities, whether that's events or letter campaigns or training initiatives. And the other advantage of ICARA is that I think our members share common challenges, and we hope there are common solutions to those challenges. So we offer workshops and symposia at other events, at members' events. And for example, recently we developed a policy to help our members to think about and to plan how they would work with commercial and other organizations where there might be conflicts of interest. And for example, industry organizations or other bodies where they're taking funding and they want to think through what the issues might be for them. So we don't tell our members what to do, but try to provide guidance to help them do the thinking for themselves on these issues. And you can find that guidance on our website also. And that's just one example of kind of where there are shared challenges. COVID-19 has been one of those shared challenges. So the first webinar in our series was looking at challenges for addiction research more generally in a COVID-19 era and during lockdowns and so on. But I suppose fundamentally what ICARA believe in is the value of bringing researchers together to discuss and share values and interests. And so if you are working currently in an area of work or in a country where you don't necessarily have the opportunity already to join a network or research association to meet colleagues who have similar research interests, and you don't necessarily have the opportunity to work together in that way, to advocate together or to tackle challenges, we would also welcome you getting in touch with ICARA. So obviously, if you have this organization and it's not already a member, we would encourage you to join. But we recognize that not all countries and not all topics currently have that infrastructure. So if you as an individual would like to build that network in your own country, then we'd also love you to get in touch with us. And we're looking at whether we can pair better established research associations with groups of researchers who are maybe starting off trying to establish those sorts of networks or organizations for themselves. This is our board. I'm very grateful to the board for all of their work in supporting these activities and indeed everything else that we've been doing over the last couple of years. And several of our board members are on the call today, including Matej, and obviously you've met Andy already, and I'm sure others as well. I didn't see all of the names popping up. We are looking for new board members, so we have had an extra year in our term of office because of COVID and this current board. So we're very keen to bring in some new people who share our enthusiasm for the value of connecting researchers nationally and internationally, and have a little bit of time that they could volunteer to help ICARA. We've had some interest from our previous webinars, but we still have room, I think, for people who would like to join our board, either as an ordinary member of the board or indeed to run for one of the posts on the board, like president, vice president, secretary, and so on. You don't have to be from one of our member organizations because the board members themselves are elected by our members. So you just have to be working in the field and keen to help. And we're very happy to welcome early career researchers. If you really don't want to take on a sort of full board membership, you can also shadow more senior board members for a while if you'd like to do that first. And please do drop me a line if you're interested in this, and happy to have a chat in confidence if that helps. Just a quick plug for our final webinar, which is also supported by our colleagues Shap and Sarn, and to acknowledge the funding of the Society for the Study of Addiction, which has made all of these webinars possible. The last one is curated by Claire Wilkinson and includes several speakers. I've just mentioned a couple of them here, but focuses on myths, lockdowns, curfews and bans, alcohol consumption and harms during COVID-19 in 4 continents. So it's a little bit of a follow-on from today's discussions, but you can also register for this on Eventbrite. And all of our recordings will be available on our website, and I also, as I understand, on the YouTube channel. Today's webinar and the next one will be on the Shap and Sarn YouTube channels also. Finally, just want to thank Andy Mohan as our chair. I want to thank all of the speakers who are presenting today, but particularly thank Chris from Scottish Alcohol Research Network and Scottish Health Action on Alcohol Problems for his fantastic help with this webinar. It's great to see so many people joining us. And just finally, to acknowledge again our funding from the Society for the Study of Addiction, and just to thank them also. Do keep in touch, do tweet if you can, and enjoy the webinar. And I hope to see you on another one again soon. Thank you. So I'll hand you back over to Andy now. I'll stop sharing.
That's great. Thanks, Niamh, for that. So we'll move right along to our first speaker. So I'd like to introduce you all to Dr. Paula Margozzini, who is a public health and epidemiology professor at Pontificia Universidad Católica de Chile. I hope I'm pronouncing this okay. Apologies. She works as a clinician in an adult family medicine. Her research has focused mainly on chronic disease prevention and surveillance. She has worked on the 3 waves of the Chilean National Health Surveys and was a director of the Chilean Alcohol Social Cost Study. She also works as an advisor and consultant for the Chilean Ministry of Health and the National Alcohol and Drug Prevention Agency. Today, she will be presenting on alcohol consumption during COVID-19, a natural experiment for alcohol policy in Chile. So I would like to hand over now to Paula. Thank you.
Thank you very much, Andy. Nice to meet you all, and thanks to ICARA for this opportunity to share and discuss with colleagues around the world on alcohol topics. So first of all, I would like to say a couple of words that could make you understand the context. Maybe you're not familiar with Chile in particular, in the southern cone of Latin America. And in short words, we have, as many Latin American countries, a huge public health problem around alcohol consumption. About 1 out of 3 high school children in Chile drank the last month, and 2 out of 3 of them had a heavy episodic drinking intoxication. 12% of our population, 15 years and older, has an audit screening positive, and over 20% of men have this risky drinking. About over 9 liters pure alcohol per capita a year, and with a clearly predominant heavy episodic drinking pattern. Our Chilean standard drink is 15.5 grams. And our last update on local study of burden of disease and social costs gave us 13% of attributable deaths, a lot of dailies, and $2.2 billion of social costs, which is in particular important to cite, is that these costs are 5 times higher than our actual alcohol tax revenue. And this is a very conservative estimate. So this is what Chile faces around alcohol, but we are very fortunate to have lots of information, and we have had past and present government authorities that have been quite sensible to epidemiological surveillance. So we have a lot of data, and this data has been very effective, slow, not as fast as we would like, but very effective in pulling through and stimulating a good policy. So if you look at the best buys around an alcohol policy, safer strategy, we can say that in Chile we have advanced a lot with enforcing drink and driving. We have a lot of work on brief interventions and treatment. And recently, just 2 weeks ago, we have this new law which enforces bans and comprehensive restrictions on alcohol advertising, sponsorship, and promotion. No more football and alcohol in Chile, and we are very, very happy about that. But there are two aspects about restrictions to alcohol availability and about prices that are still very, very important, and we have a great delay in policy. We haven't been able to enforce these 2 aspects. Quite important in Chile is the price issue, because our local spirits bottle is 4 euros, okay, compared to, Iceland, where that bottle is 84 euros. So we have big problems with this 2 type of policies. And COVID pandemic, this terrible pandemic, has given us the opportunity to study and learn more about alcohol consumption in our country, because precisely this terrible pandemic has had consequences, population-wide consequences, on alcohol availability and also on price. So what I'm going to share with you is some data coming from studies done during COVID pandemic in Chile. And we are thinking, our team was thinking about this hypothesis. We can say that COVID curfews and confinements can be considered as alcohol interventions in availability, and COVID economic shock, that has been huge in Latin America, could be considered an increase in alcohol's relative price because people are less wealthy. So we suppose our hypothesis is that alcohol consumption would decrease. So we wanted to describe change in alcohol consumption availability and purchasing behaviors during COVID-19 and discuss possible explanations and implications for public policy. Methods around this is a very important online survey done during COVID-19 long lockdowns. This study was done by our Alcohol and Drug Prevention National Agency during the pandemic. And as you can see here, we have the epidemic curve in Chile, and you can see two big waves, one going around June of 1920 and one that has just ended now, and we are very happy, that is around April, May of 2021. So our prevention agency, which is called Servicio Nacional de Prevención de Alcohol y Drogas, SENDA, made the service around those dates. So what we have done is secondary analysis of this public database about the survey. The survey used some kind of standard questions based on the European Drug Observatory web survey. They were set on websites, so we have no clear denominator. We can't construct rates or prevalences, but we can see somehow perceived of self-reported behavior change. So 34,000 people answered this survey, and we validated some of this information. There were some quite more women in the sample, and as you can see here, fewer elderly people, as was expected for a web survey. So what did we see? We have self-reported alcohol consumption change here by age. And what we saw is that most people in Chile either decreased their alcohol consumption or maintained their consumption, okay? So 43% people decreased, and there was this parallel phenomena occurring in a subgroup, which was 20% that they referred that they had increased, okay? And the most important thing is that the biggest decrease in consumption has occurred in young people. You have the decrease in blue, okay? So over 50% of people around 15 to 29-year-old, they reported a decrease in alcohol consumption when they compared the COVID lockdown waves, comparing to their previous consumption. So all age groups had a decrease in alcohol consumption, as you can see the blue bars, but mostly young people had the biggest decrease. And there was somehow around 20% increase in a subgroup that increased in all age groups. This is a significant association. I'm trying to change the slide, but I think this is somehow okay. Did the slide change? Yes?
Yes.
Okay, so self-reported change in alcohol consumption during COVID by gender. And here we can see that both women and men had this over 40% decrease in consumption. But when you adjust by age, you can see somehow a bigger decrease in men when you have a logistic analysis adjust by age. And what about self-reported causes of decreased alcohol consumption? And here I can show you different causes because they are clearly different between younger people and elder people. So the economic reason was present in both groups. About 20% said they had lost income, less money to buy, or they were saving money due to future financial uncertainty. Okay, but mostly young people had difficulty in access and consumption opportunities. Okay, difficult to buy, or due to reduction in ability to obtain because they cannot leave home, or because very important, there were fewer opportunities to consume. Okay. Instead, elderly people, they had a higher percentage of people that answered that healthcare issues were the cause of their decrease, because they are concerned about the effects on their health. Okay, so there is different reasons. And here we have some, oh, sorry, is this some causes of the increase. The subgroup, this 20% people that increase their consumption, we have the causes here. And mostly both groups, younger and elder people, talked about psychological reasons. And I note that psychological reasons, these groups included boredom, okay? Boredom, or because of anxiety, stress, depression that COVID generates in them, okay? And they also had more time, okay? And they, the time issue, having more time was an important, very important cause in over 60-year-old people. There. So there was also change in alcohol purchasing behavior. Self-reported change in the way to obtain alcohol beverage during COVID-19. Here we have people who changed, and they say mainly they changed frequency, okay? They stocked. They also changed place, 1/3 of them. And there was an important increase in internet purchase. 22% had this big change, including internet purchase, okay? And this was seen in all age groups, mainly 30 to 59-year-old people. I note that in Chile, the industry had a very, very fast adaptation to this crisis. So we had a lot of internet issues around selling and advertising around alcohol. So we saw change in availability and price of alcohol. That this kind of change were kind of a natural experiment going around this shock, this COVID shock. Of course, we don't want this kind of shocks to occur to the community, so they can drink less alcohol. We don't want that, but we have learned that change in availability and price in Chile, in less developed countries, could have a great impact in consumption. And this impact could be even higher in men and young people, which is important because those groups are the people who have highest risky drinking, okay? And this change, something that is very important, is that this change is very, very fast. You know, we have had about 14 years of delay trying to regulate advertising, alcohol advertising in Chile. And this will have an impact in future decades. But this kind of impact is as fast as a monthly days of impact. So it's very fast. And findings are quite consistent with international experiences published during COVID. Zila Sanchez, who is presenting now, also had a participation in a Pan-American Health Organization Southern Cone study, and which they find some consistent general consumption went down, and also binge drinking they found that went down. Europe has shown a kind of a less magnitude of decrease, but they also have this double pattern of decrease in some groups and a same amount of 20% increase in people. And this 20% increase that was found in Chile and other countries is very much related with mental health issues. Subgroups of people that cope their mental health issues drinking alcohol. And we also might say that the magnitude of decrease that we have seen in Chile may have been attenuated by pandemic stress, because pandemic stress will increase alcohol in people who cope in that style. And also this decrease has been mitigated, attenuated by the fast adaptation strategies of the alcohol industry, mainly by online sales and advertising. So what we are now thinking about policy implications and would be our Chilean next steps. We would certainly like to work on regulation of web advertisement and internet sales, which we have no kind of regulation. And we would like to reload discussion on sale hours, number and type of sales stores, availability, density of licenses. And we would also like to reload the tax increase discussion in Chile, mainly because of this COVID opportunity, with this economic shock in which we are. We really need our government needs money and taxes for development. We cannot afford a 1% per capita income going down because of alcohol consumption of our population. And we certainly are supporting. We have a specific strategy in Chile that is related to the Iceland youth program, in which we are supporting youth access to supervised, structured, free time use, because this issue about boredom and time and free time use is very much important and related to alcohol consumption, alcohol and drug consumption, and in the population. So thank you very much, and this is what I would like to share with you. I had another slide, and that was just to share with you our happiness about this long road we had with our parliament and discussions, 14 years of a long road of discussions in the parliament to get to this point in which 2 weeks ago we have new alcohol labels in bottles, and we have banned advertisement in sports, and also more fees for sales with children, and several other regulations. So just happy to share this with you, because things can go better with policy when there is evidence shared.
That's great. Thank you very much, Paula, for that. And congratulations on getting to that milestone so far. I think we have time for maybe 1 or 2 questions, if anybody does have any questions. Also, as the speakers are talking, please do feel free to post any questions in the chat as well for those of you who have just joined us. So welcome. Does anybody have any questions for Paula? Hi, Ian.
Yeah, I wasn't sure I got a picture of what people were drinking, you know, wine, spirits, beer in Chile. What, you know, I suppose we used to think about Mediterranean style drinking in Europe and Northern European drinking. Can it be characterized in those terms? Are we thinking beer, cider, wine, spirits? What types of drink was in my mind?
Okay. Well, Chile has this this particular pattern. 1/3 of our drinking is beer. The other third is spirits, and the other third is wine. Okay, that's our usual issues. And during COVID, we have not measured this in the survey, but there's information coming from the industry around and a big impact in sales, and especially this has been measured on the spirits sales. Okay, but they rapidly catched up, and sales are already going up and as usual.
Okay, that's great. So what we'll do is we'll move along in for time, and then we'll have some time at the end to ask all of our speakers some more questions. So I'd like to introduce Dr. Karina Conde, who is a research associate at the National Scientific and Technical Research Council and a teacher at the National University of Mar del Plata. Her research interests are the characteristics of alcohol use and alcohol-related problems, such as alcohol use disorders, injuries, etc., in Argentina, and the development and evaluation of technology in the field. She recently worked in the assessment of public policies for the reduction of alcohol-related harms in Latin America. Today, she will be presenting on alcohol consumption during the COVID-19 pandemic in Argentina, opportunities for public policies. So over to you, Karina.
Okay, thank you very much. Thank you for the presentation. I'm going to share my screen now. Okay. First, I would like to thank the organizers and Dr. Fitzgerald and Mohan for the opportunity to present the latest result of our study in this important meeting. I would like to start also with a little bit of context and the alcohol use in our country, in Argentina. It is similar to the one presented in Chile. People consume in average 9 liters of pure alcohol per year. So consumption is among the highest of the region. It is believed that 9 out of 10 Argentinians have ever drank alcohol, with little difference among genders. Alcohol-related problems are also very prevalent, and among youth particularly. The more prevalent problems are blackouts and injuries, and heavy episode drinking is also very prevalent. We estimate that 4 out of 10 young people have this drinking pattern. I would like to also mention some contextual factors by the time we did the study. In March of 2020, the main strategy promoted by the country was a system of 5 phases of strict lockdown. As the time goes by, they eased some of the restrictions, but larger cities with a lot of population were still in strict lockdown. That means that only essential workers could go to work. This means physicians, plastic supplies providers, nurses, and security forces. There were also economic constraints. Before the pandemic, we were already in an economic crisis, and that deepened when pandemic started. The state gives some relief to people, but when we measure in our study, around half of the population have reduced their income. Now I'm moving forward to the study characteristics. We use a non-probabilistic sample. We measure the alcohol consumption in 2 phases. That is 3 months before the first cases appear in Argentina and 3 months after the first cases appear. Data collection started by late June, and we ended it by the end of July 2020. We also use an online platform, Lime Survey. We use the link to the questionnaire in different social media. This is Facebook, Instagram, and Twitter. We use publicity algorithms to ensure the participation of different states of the country. Of the 2,373 people that could participate on the study, we ended up with 1,446 people. That is because we only use people that were current drinkers. We didn't use those who didn't drink in the past 12 months. For measuring alcohol use, we use 3 measures. This is frequency, quantity, and heavy episodic drinking. Quantity was measured in standard units, that is 12 grams of pure alcohol. Frequency and heavy episodic drinking were measured with the alcohol use identification test, and so were the alcohol-related problems. We used the part of the problems of the audit. We also measure socio-demographic characteristics such as sex, gender, age, and change in income. That is, if they had a higher income, equal income, or they had reduced their income. And we also evaluate alcohol-related purchases. This means people who stocked up alcohol before the lockdown started, people who use a delivery system to purchase alcohol, or people who violated the quarantine or the lockdown to buy alcohol. For the total sample, we find reductions on quantity, frequency, heavy episode drinking, and alcohol-related problems. In gender, we find some difference. While females had reduced for the 4 dimensions of alcohol use, alcohol-related problems, men had reduced quantity, heavy episode drinking, and related problems. That means they didn't reduce frequency. And we also evaluated non-binary transgender groups. We didn't find any change in their consumption. For age, the results were similar to those presented in Chile also. The higher reductions were in those 30 and younger, particularly in those 15 to 18 years in all the 4 dimensions. For those who were more than 30 years, we found reductions only in heavy episode drinking and alcohol-related problems. Related to income, we found no reductions in quantity and frequency for those with higher income. They reduce, they have a higher income now in the pandemic. But they have reductions in heavy episode drinking and alcohol-related problems. And those with equal income had not reduced their frequency. However, those with a few reduced income had reduced all of the 4 dimensions: quantity, frequency, heavy episode drinking, and alcohol-related problems. In relation to the groups of alcohol purchases, frequency was higher in those who stocked up before the pandemic, but they have reduced heavy episode drinking and alcohol-related problems. Quantity increased in those who violated the lockdown to purchase alcohol, but again, alcohol-related problems were reduced. And also we found that those who use a delivery system have reduced heavy episode drinking and alcohol-related problems, but quantity and frequency were the same. In those who didn't use any of these strategies to acquire alcohol, for the 4 dimensions were also reduced. I would like to mention some other findings in our country. There were 2 early studies, one in the Buenos Aires and one in Córdoba city, mainly. I say these are early studies because they measure only the first month of the lockdown. They found, the study in Buenos Aires found that those with 30 years or more, they had tripled their alcohol consumption, but those who were under 30 reduced their consumption. And those in Córdoba found that alcohol consumption diminished in the weekends and was higher in weekdays. This is interesting because those who drink at weekends are usually young people. And they also found that their main reason to reduce alcohol drinking was that there wasn't availability to buy it. So they perceived the access to alcohol beverage as restricted. So the main takeaway for our study was that it's an observation also, as they mentioned before, of the environment of drinking behaviors and problems. It's like a natural experiment. So here we found that with important reductions in heavy episode drinkings, we have also important reductions in alcohol-related problems. So diminishing of negative consequences in drinking could be attributed in first place to the reduction of quantity and frequency, but also the large reductions in heavy episode drinking which are strongly related to other problems which are blackouts and injuries. And for example, others like drinking and driving. And furthermore, the social environment factors, there are social environment factors that will increase the vulnerability of these groups and the cumulative risk, which are that they reduce mobility. So they could not go to some place, drink, and then drive to their homes because nobody could get out, basically. The reductions in young people also highlight the importance of the social environment in alcohol consumption. In Argentina, alcohol is sold in supermarkets and retail stores. But despite this, the young people usually drink alcohol on on-site premises, outlets. And even more, findings suggest that restricted access to alcohol, either to on and off premises sales, could be an effective measure to reduce consumption and related problems among youth. This is something that we found also in another study that we measure on and off premises, where there was less on-premises stores, the younger people had less injuries as well. Although there are much more evidence from the Northern Hemisphere, there was this study is important because we can find some evidence of how these measures, these public policy measures, could affect the consumption in young persons, and to limit the consumption and the physical availability of alcohol beverage. So, well, I think yeah, that's it. So, thank you.
Okay, that's great, Karina. Thank you very much for that.
Yeah.
And well, welcome. We have a few minutes of questions from the audience. Paul, I see Paula's hand is up.
Yes. Thank you, Karina. Very, very interesting what has happened in Argentina, quite similar to what we found in Chile. And I was wondering what was the reaction observed in the industry, alcohol industry, during this phase, this COVID lockdowns and phase. What did alcohol industry do? Did they change strategies? Like in Chile, they had this very aggressive advertisement of web sales and online.
They use a lot of publicity and promotions, and they also have a lot of delivery systems. For example, we have a lot of places that sell beer, and they quickly implemented delivery systems and promotions for those who had big buys, and all of that. We saw a lot of that. But as you said, now that bars are open again, it's like if they are back to the way they were before.
Okay, so an episodic drinking in Argentina is somehow different of, I think, from episodic drinking in Chile, because ours is very much related to spirits, our local pisco. Okay, and what happened in Argentina with that?
No, we have only the drinking is only in bars, and when it is in youth, it's mainly beer in youth. But in older people, we have a Mediterranean pattern. So we have for youth beer, and for older people, wine every day. Yes, also spirits as well.
Okay, thank you very much. So what we'll do is we'll move ahead along to our next speaker. So thank you very much again, Karina, for that presentation. So our next speaker is Dr. Zila Sanchez, who is an associate professor of epidemiology at the Preventive Medicine Department of Universidad Federal de Sao Paulo. She has a degree in pharmacy and biochemistry and pursued her postgraduate studies in the field of drug addiction, moving between qualitative and quantitative studies on alcohol and drug use patterns. She evolved one of the largest epidemiological studies on alcohol consumption in nightclubs called Balada com Ciencia, I hope I pronounced that correctly again, which identified personal and environmental factors that increased alcohol consumption among patrons in Brazil. Her two main current lines of research are alcohol epidemiology and public policies and the evaluation of the effect of government programs to prevent the use of alcohol and drugs among adolescents. And today she will be presenting on alcohol consumption in Brazil during the COVID-19 pandemic, epidemiology and opportunities for public policies. So I'd like to hand over now to Zila.
Hi, thank you, Andy, and thank you, ICARA, for the organization of the seminar. I'm pleased to be here. And the good news is that data from Brazil is very convergent with data from Chile and Argentina. And it's great because from different perspectives, from different samples and study designs, we found similar results. So it shows that maybe what's really occurring or what occurred past year during the pandemics is mainly the reduction of alcohol use. We don't know what's happening this year or what will happen the next year, but we have similar results, including Paula, you just asked about the alcohol industry. Here in Brazil, they use the same strategies they have used in Chile and in Argentina. They are doing a lot of promotions and online sales has increased. So we have similar strategies in our country. So it's interesting. In early 2020, we have wrote on a review article to try to discuss what we expected that would occur with alcohol consumption all over the world. We use these articles that have discussed other public health emergencies in other years, in other moments of our lives. For example, earthquakes, terrorism, and so on. And what we found that for some countries during these public health emergencies, we have an increase in alcohol consumption because of stress, of fear, anxiety, and so on, because of the social isolation, as Paula said, to cope with these hard feelings. And in other countries, we have, for example, a reduction on alcohol consumption because of reduction of availability, affordability, increase of prices, and the reduction on public drinking, and so on. So the doubt was at that time, what would occur for example, in Latin America, in Brazil, in Chile, Argentina, how the country would react during this pandemic, considering our patterns of alcohol use. And it was interesting to see that countries in different regions of the world had some alcohol policy changes, and they did very different actions. For example, as you know, South Africa in the early of pandemics, they have total prohibition of sales. They have changed after, but in the beginning, in the first month, they were they have total prohibition. We have, for example, some countries with limits of amounts of alcohol that could be purchased online. For example, Australia was they had this strategy. I'm talking about the strategy in the beginning of the pandemic. Everything has changed after this, but we are talking about March, April, May 2020. For example, Canada has allowed the retail of the government, the monopolies of the government, to sell through home delivery. And in the US, some states has considered alcohol sales as an essential service. So each country has reacted in a different way. And we decided to do, the PAHO decided to do a survey in Latin America to try to identify what has changed in the patterns of alcohol use in all the Latin American and Caribbean countries. I was involved in the survey. Maristela Monteiro was the coordinator of the survey. We collected data, online data, from May to June 2020, we received the answers for 32 countries and 2 territories in Latin America and Caribbean. It was a non-probabilistic sample, as you know, so we have limitations on this. Our total sample was around 12,000 respondents, and only in Brazil we have almost 4,000 respondents. You can think that it's it's almost a third of the sample, but it's important to say that Brazil represents a third of the population of this region, Latin American and Caribbean. So it was an expected proportion of answers. I will present now data from Brazil. The key finding is that in Brazil we saw a higher consumption, higher consumption in the binge drinking pattern when compared to other countries, and we saw higher indices of higher prevalence of anxiety here when compared to other countries. So we have an alert on this. But in general, we have more in all countries, but also in Brazil, more women responding to the survey, mainly in the age group of 30 to 39 years. And as I have previously said, we had, in general, when comparing the prevalence of any drinking per sex in Brazil and also in other countries, we have, in general, a decrease comparing 2019 and 2020. A slight decrease, but we have a decrease. And one data that's very interesting is different from what we expected. In Brazil, we know, and also in this study, we have reinforced this, that in Brazil, people mainly drink beer. And in 2019, we had most of beer and a third drinking wine. During the pandemics, we had an increase in the wine consumption and a decrease in beer consumption. So it's something for us to discuss, because beer is mainly consumed in parties, in occasions where people are with groups, and the groups occasion were reduced during the pandemics. And when we compare Brazil to other countries, what we have found, especially for binge drinking, Brazil has a higher Brazil had the highest prevalence of binge drinking during the pandemics when compared to other countries in this study. So it's also alarming, but it's our data. But it's curious to see that we have, when comparing 2019 to 2020, we had a decrease, a 12 points in prevalence decrease. And also, when we look to the group of 30 to 39, this binge drink prevalence was the highest. So this group was the most exposed to this pattern of binge drink or have episodic drinking. It depends on how we say, but the same concept. And so we found that this group, this middle-aged group, is a group with the higher frequency of binge drink during the pandemics. So from May to June, half of the sample from this age, 30 to 39, has engaged in at least one episode of binge drinking, five doses or more. And as Paula has previously said, for Chile, in Brazil, we have the same here. We found that most of our sample has no change in patterns of binge drinking, but we have around 4 men, around 25% that have reduced this, and 21% that has increased this pattern. So we have different groups. And then we decided to see who is the group that increases. But before saying what are the factors associated with the increase of this frequency of binge drinking, I want to show you that, again, here in Brazil, when compared to the results of other countries, we have twice the increase in binge drink frequency. So when we look all the other countries of the sample, we have 8% that have increased. And looking for the total sample of Brazil, men and women, we have 17%. So we have more than twice. And when we want to understand who is the group that's most exposed to this increase of the frequency, the group that needs more attention and more intervention in our public health system, what we found that it's for the whole sample, but in Brazil we have exactly the same the associated factors. The difference for Brazil is in the estimate, in the odds ratio, but the significance is the same for Brazil and for all other Latin American countries. What suggests that we are dealing with a phenomenon that is similar in the different countries of the region. What we saw, that the increase in frequency of binge drinking during the early pandemics, the first months of pandemics, was associated with being male, so maybe increased more, with all levels of self-report anxiety symptoms, from mild to severe anxiety. So anxiety is very associated with this increase. The amount of self-report strategies of quarantine. So the higher the number of strategies, for example, not leaving home, not taking public transportation, and so on, the higher the items of quarantine the person has practiced, the higher the increase in heavy episodic drinking frequency. And also higher incomes are associated with higher frequency of heavy episodic drinking. And one protective factor we found was, I cannot say protective factor because we are dealing here with a cross-sectional survey, but we have an association with an opposite direction from the others I have just mentioned. So not living with child was a risk factor, and who lived with child was protected for this increase in heavy episodic drinking. There is another article from our group that has shown, Paula has previously mentioned, but I will just mention what were the patterns of alcohol use that we had measured. We have measured changes in drinking before 5 p.m., online socializing drinking, and drinking with child present. And what we have found in Latin America, that the quarantine or the lockdown strategies was positively associated with a higher frequency of online socializing, as expected, and with drinking with child present. So we have an increase of drinking while children are in the same space. We also had these anxiety symptoms associated with all patterns of all these patterns: drinking before 5, the online socializing drinking. So anxiety is something that is really in a strong association with changing in alcohol patterns during pandemics. And also higher incomes were associated with all these changes, the increase of drinking before 5, online socializing. So the higher incomes are in higher risk. So we have to have this in mind too. And women tend to report less drinking before 5 and less binging during the pandemic. One thing I would like also to show that it's a Brazilian data from this study is that we have here again the twice severe anxiety in our sample when compared to the other countries in Latin America and Caribbean. It's a very important information for our public health system. We have to deal with this. Our problem is not only alcohol consumption, but alcohol consumption and anxiety, and people that are more anxious and have more severe anxiety, they are drinking more. And our conclusions are just presenting in a nutshell our results. So 70% of our Brazilian sample drank during the pandemic, around 4% practice binge drinking. But in the other countries, we have a less frequent prevalence of binge drinking, and changing in the behaviors, the risky behaviors of drinking. We have a possible substitution of beer for wine. We have more prevalent binge drinking among this group of the younger groups, not the elderly, but the younger groups, mainly 30 to 39. They're in major risk. And we have increase in frequency of binge drinking among higher incomes, and a lot of anxiety here. It's important to tell you our limitations. So we have a small sample size for several countries. That's why we compared Brazil with all other. So we have power for this analysis, but it's impossible to compare with the separate countries. It's a self-selected sample, so we depend on online access and so on, you know this. And we are dealing with only data from the 4 months of the pandemic, so maybe it can be different. So just finishing, it's very important with this data, not only for Brazil, but all in Latin America and Caribbean. We have to strengthen our restriction on alcohol availability, especially online. So we have to enforce bans of promotion and online selling. In Brazil, we are selling a lot online for underage drinking because we don't have this how to control now. So underage can buy online without any restrictions. It's not good, and we have to deal with this. And here in Brazil we have a good public health system called SUS, and we have to facilitate access for screening and brief interventions, considering that we have higher frequencies in Brazil compared to other countries of binge drinking and increase in other patterns of risk, as I have presented you. And I have to acknowledge our group that have worked in this study, and their names are here. And that's what I would like to show you. Thank you.
Okay, thank you very much, Zila, for that very interesting presentation. I see that Chris has kindly posted up the links for the 2 papers that you've mentioned in the chat. So if anybody is interested in reading up more in depth, please do have a look. So I'd like to open the floor for questions. And Ian, I see you've posted in the chat, but I'll also let you go ahead.
Yeah, as a clinician who treats people with alcohol dependence, often when they first come to me and they're drinking heavy, they're very anxious and depressed. And once I've detoxified them, their anxiety and depression levels fall off markedly. So I suppose my question is, you're finding that, you know, binge drinking is higher in amongst people who are anxious, but these could be alcohol dependent individuals, and their drinking could be causing the anxiety, you know?
Not only dependent drinkers, not at all. So we have we have also people that are not dependent with high levels of anxiety, and we have a 2-way association. So binge drinking may increase anxiety, and the anxiety caused by the pandemics may be increasing the binge drinking for this group of highly anxious people.
Yeah. Did you measure SAD-Q, or did you measure? Did you have a measure of alcohol dependency in your samples?
Yeah, we have some indices of frequency of alcohol consumption every day, and we don't have audit, but we have the frequency. So we have even people that were drinking doing binge once a week with high levels of anxiety. So they would not feel the items of dependence, at least the 5 we have in our survey, but they were also extremely anxious.
Thank you.
So I'd like to just open up the floor now for any questions that we have for our 3 speakers. So Mariana, thanks.
Well, I just wanted to thank all the presenters and the organizers. It was very interesting for me. I was not familiar with the data they presented from Chile and some of the data from Brazil. It was very, very interesting. And besides thanking you for this opportunity, I wanted to point out how all the results highlight our region, the southern corner of South America, like a very problematic region in terms of alcohol use and alcohol problems. And how, although we don't have much evidence of, like the Northern Hemisphere has, about the effectivity of some public policies, all of these point out to the importance of environmental factors on drinking, especially affordability and availability, and how if we were to promote those actions in our countries, they will probably have a high impact. I'm kind of envious, and I have envy, I don't know how to say it, for what Paula said. Yes, Paula. What Paula said about the new legislation in Chile. I think in Argentina we are very far from that, and I think we have also like another problem, and that we have like 3 level of jurisdictions to regulate new policies, because we have some of the state, the national level, and also the state, and also the city level. So I think that's another issue besides the interference from the industry. And I also think it is very important that for what you said, how the ban on advertisement and marketing has to be very, very comprehensive, because it's very clear how the industry changed strategies very rapidly when the situation changed. So nothing, I just wanted to point out, besides thanking you, pointing out the need to implement better public policies, at least in Argentina. We are very, very far from the safer standards. Thank you.
Thank you very much, Mariana. And Paula?
Yes, well, thank you, Zila, for a very nice study with a lot of variables that you could associate. And I was seeing in your data that you had a kind of when there was intergenerational interaction in houses, there was protection, and that's very interesting. This also points out some of our new strategies we are using in our policy with youth in Chile, because parenting and parenting control and presence at home is a very has been shown also in Chile in our surveys in schools to be a very important protective issue. So that is very good. And I was going to add that you have said that these studies have been done in the first early pandemic phase, no? But I can tell you, I didn't show it to you today, but in Chile, we have done 2 surveys, and they are 1 year apart, one from the other, the same questions, and we got the exact same results. So even though the industry has had more than a year to adapt, when you have these restrictions to availability and you have economic shock, the decreasing effect persists. So this has been just analyzed in April, in our our wave in 2021. Just the same thing, everything.
That's really interesting to know, Paula. Does anyone have any other questions? I was wondering for our 3 speakers, we talked a lot about, the industry tactics, and especially things like the online advertising, web advertising. I wonder across the 3 countries, in terms of, I suppose, the public awareness or the public appetite for changing these things, is there a high level awareness among the public, or is it something that it's not really a concern then across any of the Argentina?
I don't know how to answer this. I'm not sure. I don't know if Paula or Karina.
I mean, are you referring to what are people aware of the industry's tactics?
Yeah, I suppose, I guess the increase. So, for example, yeah.
Oh, they are not aware of that.
No, I don't think so.
We are working on new projects with teens in schools in the food environment issues, which is the same as the alcohol environment issues. Everything is much happening the same way. So, and we are working on interventions on teen awareness of the food environment and the industry presence. Okay, so making some kind of citizen science, taking pictures and things. Teens will work on this kind of issues. We're starting with food environment, but I am willing to go to the next step, which is making the same thing with alcohol advertisement and availability environments around schools and teens. Okay, mainly around the trail you go from school to home and all those issues.
Yeah. I have an echo here. I wanted to mention that we found in our study also that people believe that we asked if they believe that alcohol consumption was higher or lower. They perceive that the people was drinking more. And we believe that has to do with the impact of the industry. They were promoting news saying that alcohol consumption was going up. So everybody believed that it was going up, even when it was going down. So that also is a point to change social norms and how people perceive alcohol, and that might affect also their drinking.
Okay, Zila, I'll leave the last word to you.
Yeah, so same thing here. So all the media was talking about an increase in alcohol consumption, but it was not what we found. Not only in our study, but in 2 others that were done here in Brazil, and also I'm not pretty sure if people are not aware of the strategies of the alcohol industry, because they are some of them are very happy because the industry is increasing the promotions. So it's cheaper to buy alcohol. It's easy to receive now at home. So people are discussing. So I think a group is aware that the industry is offering, is increasing the availability. So that's why I'm not sure if the majority of them are aware or are not aware, but we should investigate this. Great.
Yes, great. Thank you very much. Well, I think we'll leave it there. So I'd like to thank our three speakers, Zila, Paula, and Karina, very much for those interesting presentations. Thank you to Chris from Shap and Son for facilitating this. And again, thank you to our lovely audience for attending and your questions. So as a reminder, Chris has just posted the link for our next event, our last ICARA webinar on the COVID-19 and substance use. And that should be an interesting one because we have presentations from South Africa, India, and Australia, looking at myths, lockdowns, and curfews and bans related to alcohol consumption in these areas. So please do join in. That's August 17th at 11 a.m. British Standard Time if you're interested. And yes, so thanks everyone, and enjoy the rest of your morning, day, evening, night, wherever you're based. Thank you again. Bye.
Thank you. Bye.
Bye.